Hey everybody, I'm Ben Gromicko from InterNACHI, and you are on a NACHI TV webinar, or maybe you're watching the video recording of a webinar that we're doing. And on NACHI TV, we do monthly webinars, free, online, live, open to everyone. Sometimes I'm teaching, sometimes we have a special guest. And if you go to nachi.tv, NACHI.tv, you'll go to this page here, and that's our cute logo with the TV. And you click the button that says register for a free webinar. And today we are talking about the Home Inspector Health Fund. And we are joined by Jim Harkins, that's the Executive Vice President of Operations. And we're going to talk about Home Inspector Health Fund and what the benefits are, an overview of the fund, what's being offered, and how the coverage works, and how it may be a good fit for you. And let's see, I'm going to give Jim, are you there?
Yes, thanks, Ben.
Okay, I'm going to give you controls. So a window should pop up on your side. And
okay,
feel free to ask questions. Jim's here to ask questions during the webinar. I'll interrupt him if you have a question, or after the webinar. He'll give his contact information at the end so you can contact him with further questions. Jim, are you ready to go?
Yeah, I really appreciate it, Ben. Thanks for switching it over here. So thanks, everyone. My name is Jim Harkins from Villanova Insurance Partners. And really the main objective of this clip of this webinar is to give an overview of the Home Inspector Health Fund. So everything that I'm going to be talking about today, it's really considered a rolling open enrollment. So what that means is if you enroll in the month of February, let's say, the effective date of this coverage would be effective April 1st of 2020. If you decide, you want to take some time, think over your options, and you enroll in March, then you would have a May effective date, and so on and so on. So I think we can all agree. I know I can be up here for an hour, 2 hours talking about all the politics of healthcare in this country. I think we can all agree that healthcare is a little bit kind of out of control right now. At one point, the government decided that they were going to allow major medical, like your Aetnas, your Blue Crosses, your Cignas of the world, Uniteds, to give access and allow associations the opportunity to enroll in association health plans. At one point, that was not allowed. They decided for a short period of time that maybe that would go into effect and you could enroll, and then ultimately they went back, they reversed on their decision again, and they decided that that was not going to be a go. So really what that hurts, that really, the people that suffer from that are really kind of, your single member LLCs in associations, small groups throughout the country that typically your only options for healthcare is to go onto the exchange, and those federal exchange rates through Obamacare, those rates have been increasing since the inception of the entire program. And depending on where you live, some of those rates only for a very, very basic plan are kind of astronomical, and it's really the fixed costs are so high for for a coverage that doesn't offer comprehensive value. So what we've tried to done here is kind of think outside the box, and I'm going to really just jump right into the product that we're offering. This is unique for home inspectors and specifically InterNACHI. So here's a broad overview of the program. This is the Home Inspector Health Fund. Down here you have, it's really a three-pronged approach. It's a product that we kind of took three pieces, bundled together to offer the most robust coverage for members and their families. So you can see that this large gear right here, this is your Sedara. So what Sedara covers is your kind of facility claims, your outpatient hospital, your inpatient hospital, emergency services, kind of your unexpected illnesses, your unexpected accidents that you would have, and these are your most costly, potentially your most costly claims that would happen in a actual facility. So Sedara, and I'll go through and talk about, more about that. That's the main piece of this entire program. The second piece is up here, the yellow gear, is your Apex. So Apex provides coverage for more of your more common procedures, like going to a primary care doctor, a specialist, urgent care, and they also have prescription drug coverage through Apex as well. And then we also have Teladoc. So there's 24/7 availability for, you can reach out to a doctor telephonically or on video for kind of your annoying symptoms that come up throughout the year. And the great thing about this Teladoc program is you can use it as many times as you like. It's 24/7. You have access to a panel of physicians at your fingertips, and there is no charge to access this service. All right, so that's kind of the three-pronged approach, how we bundled up this, the Home Inspector Health Fund. So I'm going to start and give a broad overview of the Sedara program, and I think this video really captures, it's about 2 minutes, so I'm going to play this during the webinar. I think it's really gives you a lot of good points on how the program works, and then after I'll talk about a few of the options that you have to elect within Sedara.
Sounds good.
Sedara delivers a fresh approach that's reshaping the healthcare landscape. How? We provide uncommonly high levels of service and a superior healthcare experience while delivering tremendous value for members and their families. It's a model built on 30 years of experience within the medical cost-sharing industry. We've taken the best innovations of the modern sharing economy and offer them to our clients today. How does Sedara's medical cost-sharing work? The Sedara solution blends several service options to offer our members a high-quality healthcare solution at a low cost. Sedara members typically save 30 to 60% compared to other healthcare options. In addition to medical cost sharing through Sedara, groups may independently provide access to preventive care, a health savings account, or a direct primary care relationship. For large, unexpected medical expenses, Sedara's community is here to help. There are no out-of-network concerns when it comes to medical costs. Members can visit the physician, clinic, or hospital that best meets their needs when they're sick or injured. The key is that our members present themselves as self-pay patients. That's how the Sedara community maintains affordable monthly contributions. If a medical provider takes cash or credit, they'll be happy to serve our members. At Sedara, we're building a new kind of community, one whose members commit to pursuing a healthy lifestyle and sharing the cost of medical care. We would love for you to join us and invite you to reach out today.
All right, so back from the video, I hope that was helpful and gave a really quick overview of the Sedara product. And I just want to, capture on this page, so within the Sedara bucket, within that, really the hospital coverage, outpatient, inpatient hospital coverage, you have the opportunity and the choice to elect one of 5 plans. So stemming from on the left-hand side, you have a $500 deductible all the way, and you can choose a $5,000 deductible depending on kind of, price level. And if you're, trying to being honest with yourself, you try to figure out what type of utilizer you are. So are you somebody that maybe is ER prone, that wants to pay a little bit more for a $500 deductible, or do you want to have, roll the dice, you're fairly healthy, you hardly go to the doctor, and maybe you want to settle for a $25,000 deductible or a $5,000 deductible, which will obviously have a lower cost. So depending on which bucket that you choose, a 500, 1,000, 1,500, or 2,500, or 5,000, all of those elections, all of those options are still going to cover, the same basic services. So you have access to ER care, hospitalization for inpatient, outpatient, surgery, both inpatient and outpatient, and maternity claims, imaging, x-rays, and labs. So what we're kind of recommending and we're advising all members to do is to, enroll in the InterNACHI member portal, the benefits portal powered by PlanSource, and that way you can view all of your cost information and view all the elections. And I'll tell you more about that on how to enroll further in the webinar here. So I do want to, take the time and be fully transparent. This product, the Home Inspector Health Fund, it is not considered an actual insurance program. It's an insurance alternative. And having said that, is there, through Sedara, there are pre-existing conditions. And basically what that means is if you were ever diagnosed with a major illness or you had a major accident within the last 36 months, Sedara is subject to kind of review those claims, those services, and potentially not cover you or only cover you for a portion based on, what kind of claims you had. So if you had a cancer or a heart attack within the past year, just coming from my recommendation and my advice, this program is probably not best for you. It probably makes sense to, find an actual insurance program through the exchange or through a spouse or another alternative. But for those members out there, if you kind of look at the last 5 years, if you are paying for insurance, there are high monthly fixed costs. And if you're, fairly healthy, you don't have any major problems, major concerns, you're not in and out of the hospital or have any major diagnosis, this program is perfect for you. It eliminates those high monthly costs and, but with still at the same time providing robust coverage in case of if you have to go to the hospital, if you have any kind of accident or an illness comes up unexpectedly. All right, so having said that, that is really the kind of Sedara bucket of, out of the three. The second kind of aspect of this whole program is Apex management. And Apex really covers your most common procedures, like just going to your preventive care, your primary care, your specialist. It covers urgent care, all at a fixed copay. So if you want to go to a primary care, it's $20 copay. You know exactly how much you'd be paying prior to the insurance or the program even starting. And then you have a specialist copay of $50, and urgent care, you have 3 visits at $50 as well. Throw in lab imaging, MRI, and CT scans. They also provide coverage, as well there, as you can see with the chart here. You have, so what Apex does, you actually get an insurance card. You have coverage through the PHCS PPO network, so there's national coverage all throughout the nation, and that will be the same for your prescription drugs as well. So the pharmacy that is used is called Welldyne RX, and for your low cost, your generics and your preferred brands, it offers coverage for any of your prescriptions as well. And there's for your more expensive, your specialty and your non-specialty, you can see that the plan does pay a max of $150 or $250 based on the cost of those specialty meds. All right, so the third prong of this program is the telemedicine through Teladoc. So as I mentioned before, Teladoc, it gives you 24/7 access to a panel of board-certified physicians. So for your annoying symptoms that come up throughout the year, like any kind of ear infections, sore throat, pink eye, like poison ivy, instead of rushing out to an ER, instead of rushing out to an urgent care center with higher costs, you can have access to this Teladoc and you can communicate with them either electronic or telephonically, or through a video like a Skype or a video call. So think about, if you're 2 o'clock in the morning or, the second day of vacation, you have an ear infection, you can literally that day call into Teladoc. They can diagnose you right on the spot. And then what's really great about this product is they can send a prescription to a local pharmacy, and that access of care happens that much quicker, and it's really convenient. It's really a growing product throughout the country. So really, that's the roll-up of the Inspector Health Fund. You have the Sedara, the Apex, and the Teladoc, which kind of, wraps it up. So here's how you actually enroll. So if you go to www.nachi.org/insurance, you can see that this homepage will come up, and what you would want to do is look to enroll now and check rates. So as you navigate through those pages, you just fill out basic demographic information. That gets fed over into our back system, and then you would receive an email with specific login information, a username and password, where you can start to access what coverage is being offered, the Apex, the Teladoc, and the Sedara, along with dental and vision. And you would come to this screen here with the logo in the left-hand corner, and what you want to do is click Update My Benefits right here. And then that's going to bring you to this page. So depending on when you actually enroll, whether it's in February, March, or April down the road, you want to put in the day that you actually log in here. That's going to be your event date, what we're calling a life event. So if you decide to do this in February, like I said before, the effective date of coverage would be April 1st. If you elect in March, you would be May 1st, and so on and so on. So after you get to this page, that's really when you get into exactly what's being offered, what the cost of the coverage is, and all throughout the plan source, the benefits portal, you can pull down benefit summaries for the Apex, the Sedara, the vision, and the dental program. So you have all your information bundled up in one spot, and you can review that on an ongoing basis. So I know this is a lot of information. It's definitely an outside the box strategy to your conventional insurance programs out there. But we vetted it. We heard a lot of good feedback throughout partners throughout the country that are using this, and other associations. So that being said, I just want to make sure that if you have any questions, feel free to email us at novaassist@novainsurancepartners.com. We will be checking this on a hourly basis. We're around to help you with any questions about login information, resetting passwords, and then just general information on any of the insurance products that are being offered. So I hope this little clip was helpful, and I look forward to answering any questions and hearing any feedback on the presentation.
We do have questions, and I'm not sure if you wanted to take them now, or those folks can email novaassist@novainsurancepartners.com. Would you like to hear the questions?
Yeah, sure. I can answer a few right on the spot right here. And if I don't have the answers, I can certainly get back to anyone directly.
Wes asks, is baby delivery covered?
It is. Delivery is covered as long as you're not currently pregnant at the time. So if you are not pregnant and you decide to enroll in the program and then become pregnant at a later time, there is a fixed $5,000 cost for maternity.
Larry asks, I've always had plans that don't have deductibles, so I don't really understand deductibles when it relates to health coverage. Can that be quickly explained?
Yeah, sure. So what a deductible is, it's an employer or a member responsibility similar to an auto deductible, where that whatever the deductible dollar amount is, that has to be satisfied prior to the plan kicking out, being responsible for the remaining cost portion. So if you take the example of like an outpatient surgery, let's say that outpatient surgery, you had a skiing accident, or you're working on your house and you fell off a ladder, you had to be rushed to the hospital. That visit, that service costs $10,000. If you chose to have a $500 deductible, your out-of-pocket responsibility is $500, and then the Sedara, the health fund, would pick up the remaining charges. So really, you're only out of pocket that deductible amount, and everything after is covered at 100%.
Let's see. We have Ajit asks, is this for Canadian citizens also, or just United States inspectors?
At this time, it is for United States inspectors. we are working on a solution, but it's not quite finalized yet for the Canadian home inspectors.
Okay.
And I apologize for that. But.
Can multi-inspector firms offer this to employees, inspectors, the marketing and office staff?
Yes, they can. So whether it's a single member LLC or a group inspection program, it is available to the association as a whole.
Robert asks, are there any states where this is not available? I'm in New York, and often I find that exclusion.
No, this is offered in all 50 states across the country.
Brian asks about pre-existing conditions, and is this considered health insurance? It's not. It's not considered health insurance, and there is a 36 months, I believe you mentioned.
Yeah, that's correct. And I really do want to reiterate, and being fully transparent. Obviously this product it's not for anybody. It's really for those people that feel like they are fairly healthy, they keep in good shape, and don't have are really just tired of paying high fixed monthly costs and never using the plan. So you will see, and I forgot to mention this, and you'll see this as if any members decide to go into the benefits portal, that you'll see savings anywhere from 10% all the way up to 60% when you compare this program to insurance exchange programs and conventional insurance.
Todd asks, can premiums be used as a business tax deduction?
They cannot, because this program is technically not considered insurance.
Are domestic partnerships covered?
That is a good question. I believe it is, but let me circle back and get a definite answer on that.
Let's see. There's Aaron asks, has a list of pre-existing conditions. So there's a huge list of are these covered or not covered. So Aaron, you may want to email that list. What's the primary difference between a cost sharing program and a regular insurance coverage? George asks.
So I would say that the biggest difference really is the upfront premium cost. So you're going to see that in a health sharing fund, the monthly premiums, whether it's for a member only or family coverage, are significantly lower. And I would say the main difference is, like through an Aetna, United Healthcare, or Cigna, they have a large network that is considered either in-network or out-of-network. With Sedara, you have coverage at any hospital you like. You have the freedom to go wherever you like, as long as they would accept cash or credit. Typically, you'll see the other big difference is that pre-existing conditions clause, where if you have employer coverage through one of the big four insurance carriers, they do not have pre-existing, whereas Sedara does. So I would say those are the two biggest differences.
People are asking for the URL to sign up, and it's nachi.org/insurance. I put it up on our screen.
Yep, Gregory, that's it right there. Yep.
Gregory asks, is this open to family, spouse, or just InterNACHI members?
No, it's open to all family members that are tied to an InterNACHI member.
Richard asks, is a physical required?
No physicals are required for this. What comes, you get preventive visits, primary care visits, and specialists, but there is nothing required, prior to signing up.
And Brett asks, does this account come with a debit card or a credit card to pay the doctor?
No. So typically what happens is there's no HRA cards, there's no funding mechanisms. It's when you go to a hospital or you need to access care, you just explain that you're a cash pay patient, and they're not going to charge you up front. And when you receive the bill, as soon as you receive the bill, you make an outreach call to Sedara, and you'll have all that information when you enroll. And they really do the dig. They do the digging from there they'll get your information, they get the bill, they outreach to the provider directly, and then they work out the finance, and they'll bill you for whatever plan that you chose. So if you chose the $500 plan or the $5,000, your InterNACHI, your member responsibility will be based on which plan that you chose.
Okay. Jerry asks, if this is not considered insurance, quote unquote insurance, will I still be taxed for not carrying insurance at the end of the year?
So that mandate actually went away. I believe it was it's no longer in effect. I forget the actual date offhand. It was either 1119 or 1120. But you do not have to carry. There's no penalty for not having insurance in the country anymore.
Is there an age limit on dependents that can be covered by this?
That's a great question, actually. I believe I have to double check on that. I believe it is 26, but let me circle back and I will post that on one of the forums.
And Scott asks, can my spouse be on the plan if she's not a member of InterNACHI?
Yes.
Let's see. So let's put up that, maybe we should put up that email again. Or is the URL good enough? The nachi.org/insurance for further questions, because we have a lot more questions with a lot more details.
Yeah, and I would love to, if anybody has any questions, that email address is novaassist@novainsurancepartners.com.
Give me that one more time. Yeah. Hold on just a second, and I'm going to type it up here so that people can have it. And it's Nova Assist. That's 2 A's.
Yeah, 2 A's. I know it looks strange, but that's the way. At novainsurancepartners.com. So, and we're always, our team here at Villanova, we're always reviewing these inboxes, and we'll get back to you within the hour, especially early on, and then, ongoing questions as well.
Well, thanks very much for doing the presentation for us. I bet you're going to be flooded with some questions there, Jim.
Yeah, probably. And once when the emails come through, and I'll give out our direct cell numbers as well. So we'd love to talk over the phone if anything can't be answered over email as well.
Awesome. Well, thank you so much for taking some time to explain it to us. And goodbye, everybody. I'll see you next time on another webinar. Thanks, Jim.
All right. Thanks, everyone.